A new campaign aimed at demystifying HIV is underway in Ghana to help address the issue of stigma among pregnant women and mothers. The community-based campaign is currently being run in the Greater Accra region and the Eastern region. Matilda Gavi of our health desk puts the spotlight on an HIV mother of 5 who is currently a mentor to other women who find themselves in her position.
A mother of 5 and HIV positive is among 12 mentor mothers selected to support other mothers in parts of the country. Faustina, who was once depressed over her status as an HIV positive mother, is today bringing hope to mothers living with the condition in parts of Ashaiman.
It wasn't easy. The first day they told me about my HIV status, I was like, how? Why? So many questions, but there's no answer from anybody. And I quite remember the time I was pregnant and I visited the antenatal clinic. They asked us to go and test. They have a particular room that they say they are testing here for HIV. So those of you who are interested can go there and test. And for me, I know and for my experience saying that time, I was saying that no, I'm a married person, I cannot be HIV positive. Meanwhile, I was positive, but they don't know until I gave birth to the child that has passed away. I used that experience to encourage them.
Mothers to Mothers, a non-governmental organization that promotes healthcare in mothers and babies, is empowering these mothers living with HIV positive. The 12 mothers identified as mentor mothers were selected on the basis that they tested HIV positive, had a child between 0 and 3 years, had disclosed their HIV status to at least one relative, and had the ability to advocate a stigma-free environment. The 12 mothers will work at project areas including Ashaiman Polyclinic and Etua Government Hospital in Odumase Krobo in the Eastern region. Yvonne Prempeh Ferguson is the technical specialist and country director for Mothers to Mothers Ghana.
Our mentor mothers are people, are young HIV positive women who have gone through the PMTCT cycle. So they also share their experiences with mothers who are about to experience what they have experienced. So they're able to share their experiences along that journey for the mothers who are just about to begin that journey. Mothers, 6 will be based in Lower Manya Krobo and 6 will be based in Greater Accra region. And in those regions, 3 will be based in each facility, and they will comprise a facility team leader who is supported by 2 facility mentor mothers, a community team leader who is supported by 2 community mentor mothers. So we have 4 team leaders and 8 mentor mothers, and they are based in the regions and the surrounding communities in the districts where we work, especially from the catchment area where the facility is.
Chief Executive Officer of Mothers to Mothers says the project is hoping to reach over 11,000 women and children under 3 years from 2020 to 2021, reduce HIV infections, and create economic empowerment opportunities for all women with the virus.
We looked at Ghana and we understood that this was a modest stepping into the country. We were trying to make sure that is West Africa going to match the same as we've done in Southern and East Africa? And we know it will, and we will also be looking at those next sets of investments.
With funding support from British Airways and Comic Relief, the 12 Ghanaian women living with HIV have been trained and are employed. Alice Cruz, the Chief Executive Officer of British Airways, said the health and well-being of a family were important and that it was imperative for children to start living in a healthy way.
It was launched in 2010 with the aim of helping children and young people from disadvantaged communities around the world to fulfill their own potential.
The 2-year project ends by 2021, but Ghana's Health Ministry has plans to sustain it.
So this is an area that the ministry can learn from and to be able to sustain this beyond the 2 years. But even between now and the 2 years, we are working closely to learn from this and to see how we can scale it up beyond the 2 regions and the 2 districts that they are working in, and then to take it as something that can cover the entire country. We want to see an HIV-free generation.
In the long term, the Mentoring Mothers project seeks to anticipate, promote healthy, thriving children and families, reduce HIV-related stigma, and encourage community health workers to lead the way to the delivery of sustainable development goals. For JoyNews, Matilda Gavi.